Call the Health Committee meeting to order. The previous business, a motion to approve the previous meeting minutes by Gary. Second. By Gil, all in favor? Any opposed? Unanimous. Under current business, number 2, authorizing an agreement with Schenectady County Community College regarding the health worker intern program.
Good evening. Happy New Year. So the first RLA that we're presenting today is to enter into a contract with Schenectady County Community College. They have a CHW, which is Community Health Worker Program, and we have a very strong workforce for community health workers, and it's for us to enable them to have an academic work experience.
Any questions from the committee?
Yeah, I just have a question. Mr. Chairman, how much should they make, or are they no pay, or what is it?
It's cost neutral to us.
Someone else pays it for them, or?
It's an internship, so I believe it's unpaid.
Okay, no, because there are a lot of paid internships,
Yeah.
so. No,
It's
that's
unpaid.
unpaid? Okay, then that's a good price then.
Yep.
Thank you.
It's a good price.
Hey, you come in with no experience, you're getting a lot of good experience. That's the whole point of it.
So what do we consider a qualified community health worker?
So Schenectady, in terms of our workforce or in terms of the program for Schenectady County?
Say again?
Are you asking about our workforce or are you asking about the Schenectady County?
Yes, right here it says, I'm looking at
Okay,
what the
no,
justification is.
And that's a really good question. So community health workers are important members of our healthcare team at the health department. There is not a specific qualification that qualifies you as a community health worker, and what this program is trying to do at Schenectady County is to implement a system where there can be a more formal training. Our community health workers do a formal training through the New York State Department of Health, and they work on, their main focus of work is linking people to health services and addressing social determinants of health. So we have community health workers that work with our maternal child program that will go out into the community and assess health needs and make connections, set up appointments, go to appointments with people, and link them to other social service needs they may have in high-risk communities, such as DSS or housing or other needs. We also have community health workers that are working on hypertension, that work with establishment of hypertensive registry and practices, and again, in high needs communities, they help connect people to services that they need.
Dr. Whalen, is insurance in place for this, like liability insurance, or?
The college will provide
Okay.
insurance certificate once we get approval to go ahead with the contract.
Thank you. Joanne?
So do they actually come out of community college with a degree as a community health worker?
I believe it's a certification.
Okay. So it's a 2-year program, but it's a certification. Okay.
It's a certification. And in Schenectady County Community College is one of many academic institutions interested in doing this. And it's also kind of a stepping stone to people that may want to go on and then get degrees in nursing or other allied health professions. Yep.
Any other questions from the committee? Hearing none, can I get a motion move? By Gary, second by Joanne, all in favor?
Aye.
Any opposed? Unanimous. Realized I skipped right over number 1, and I see Mr. Mariello is here. Resolution number 336, a resolution to initiate a pilot polystyrene recycling program. I understand it would be tabled?
We're going to table that.
Okay,
yes.
thank you. Just wanted to make sure we acknowledged it. Under current business number 3, amending resolution number 316 for 2015 with the New York State Department of Health regarding the Healthy Neighborhoods Program grant. Dr. Whalen?
So this is just a reduction in the funding that we have been given in accordance with the New York State Department of Health for Healthy Neighborhoods. It is not expected to impact our personnel. A large amount of the work that is done through this grant is through Cornell Cooperative Extension, and it will be a reduction to what we provide them to do services in the community.
Brian?
Question.
Aye.
So this was based on the budget that was passed last April from the state, right?
Yes, this is based on fiscal year 17-18, New York State.
Do we know if the governor's proposing even more cuts to this program for the next budget year? given the budget hole, I wouldn't be surprised.
It says here in the thing, the language, the same monetary reduction will be applied to the term for 2018 to 2019. Yeah.
But that's through next year. The budget's enacted on in April, will go through 19 into the next year. So I was wondering if there's anything in the governor's proposed budget about the 8 localities for next term.
No, it's 2018 through 2019 now. Yeah, no,
Yeah,
this,
March
yeah.
of 19. After that, though.
Yeah. Oh, beyond that, you mean?
Yeah.
Okay.
I don't know information for this particular program, but I know that there are discussions about budget cuts that may be kind of consolidating programs and making decreases in funding.
I'm worried we probably are going to have to deal with that, so it's probably not too soon to think about how we can possibly streamline things next year.
Yeah, we are.
Unfortunately. Thanks.
Any other questions?
Yeah,
from the committee?
Mr. Chairman?
Mark?
Yeah, this has happened before. I remember there was a tuberculosis testing thing I think they cut and stuff. Does this really happen frequently now, that they're cutting the money for these things?
I think within this year, we've had cuts to, is this the third program? Yeah,
Yeah. And have they offered any explanation?
no.
It's limited funding.
Yeah, well, well, not for its commercials, so I think this is something to be concerned about.
Why not?
Write your legislature.
Yeah.
Well, it's not just, I mean, we're fortunate that we've seen continuing resolutions to fund all the federal public health programs, but at some point, those continuing resolutions that keep us at status quo are going to end, and what you're going to see are pretty significant cuts in public health at the federal level. I mean, in the president's budget this past, in 2017, all of those programs got significant reductions. So welcome to budget deficit politics, and public health is always getting the axe. So Dr. Whalen is certainly going to, I mean, I don't know how much you've gotten any lead information from, the county health association, health officers association, but at some point we need to have a real reality conversation about what those cuts are going to look like, because they will trickle down at the county level, I am 100% sure.
Yeah, there's definitely discussion about that at the state level, at the New York State Association of County Health Officials. And, public health, we're used to, I'm not saying it's a good thing, but we're used to trying to do more with less. But we're definitely keeping an eye on the bottom line.
Wanda?
Can I just ask another, I'm sorry, Wanda, I just wanted to ask another question on some of the impact of some of the ACA repeal efforts. Do you get information from your sources about potential ripple effects at the county level on any of those?
We don't get as much information on the ACA reforms. A lot of that would cover more providers, so hospital-based services and access. We do, post-ACA, it was encouraging to us that there were more people that were in need of services, that were covered services. So that's always a concern that now we have made strides to link people to the programs and services and the care that they need, that those may no longer be available.
Thank you.
Wanda?
Okay, so I noticed that this was a 5-year, and it ends next year, okay? So we have this year and next year, okay? So in this year, there was 288,000 allotted, and now it's 263.
Mm-hmm.
So do we know, have we assumed a certain amount already for next year?
It's going to be the same amount for next year.
288 or?
No, 263.
Oh, so it's down to 263,
Yeah,
okay.
yeah.
All right, so that's my first question. My second question has to do with the targeted geographic areas, because right now, is South End included in
Absolutely.
Okay, and also Sheridan Hollow with the Answers Plant?
I believe Sheridan Hollow is. Do you have the?
I have a zip code.
Yeah. I believe it's 12202 and 12206, which would be the two.
That's not 6.
Yep, 12202, 12206, 12210.
Okay, but is the Answers Plant, are you aware? And because it says here, do you know what kind of health services we're talking about? Because we know that there was like really chronic illnesses that went on because of the Answers Plan.
Sure. So what, I can tell you what the Healthy Neighborhood staff does. They really go door to door and they look for, they do home assessments to determine risks of health effects in the home. So they would go in and do a full assessment of a home looking for a broad range of health concerns, from lead paint to carbon monoxide detectors to smoke detectors to other risks. In addition, they look for asthma exacerbators, so if there were a lot of dust or if there's pests. They provide cleaning services and they link people to services that they need for remediation. In addition, if there are homes where there is a child with asthma, we have a nurse that works at the health department who will go out and do assessments on the child and work with the child's pediatrician to formulate an asthma action plan, which is an evidence-based strategy to ensure that medication is appropriately utilized and is done to reduce avoidable hospitalizations and other complications of asthma.
Any other questions from the committee?
Just the comment that Wanda just raised is interesting, because when the Answers plant was closed, they didn't have the concentration of new housing on Sheridan Avenue, and right now there are a number of people who were victims of the Answers plant who are still there, and the governor's proposing a new microgrid, and there's still people living like right next to the plant, so that's kind of an interesting kind of problem we're going to have to deal with. But okay.
So when you, I'm sorry, just one more thing. Sure. So, is it at all possible, you gave us the zip codes.
Mm-hmm.
Can you tell us how many homes in each zip code?
Yep, I could tell you that. I don't have the numbers off the top of my head. It's written up in our annual report. Mm-hmm.
That would really be helpful.
Yeah, we'd be interested to see it.
I can certainly provide that.
Okay, thank you.
Any other questions from the committee? Hearing none, can I get a motion to move? By Brian, second by, was that Gil? All in favor? Any opposed? Unanimous. Number 4, authorizing an agreement with Ocean Incorporated regarding electronic medical health record services.
So this is a request to enter into a contract with Ocean. We submitted requests for proposals for electronic medical records, and I'm sure most of you are aware we operate clinics in STD and in TB and immunizations and in dental health for children. And as yet, we do not have electronic medical records. We are mandated to have e-prescription, which we haven't yet from the New York State Department of Health. This will also contain e-prescribe, and it'll also enable us to link with HCSCNY, which is a statewide medical database, which will facilitate a lot of the work that we do on communicable disease and reaching out to contacts of individuals with communicable disease contacts, etc.
Only 3 bids on that, Dr. Rowe?
Yes.
Okay. Looks like they scored far higher than the other 2. So, any questions from the committee? Joanne?
So it's a state mandate that public health providers connect to, or is that a federal mandate?
Not that we connect to EMR, but that we use e-prescribe.
Right.
And that's for all prescribers. It's
Okay.
it's not public health.
So there's no money associated with the mandate to connect to the e-prescribe?
There is not.
So could you do that without connecting to an EMR system? Or you might as well, since that's a piece of it?
You can parcel it out.
Okay, just smarter to think holistically.
Yeah.
Okay.
Yeah, I think especially with HCSCNY, it would be the best use of our staff, and it is really kind of the way forward.
Right.
We're a little behind the times not having it.
Mark, did you have a question?
Yeah, thanks, Mr. Chairman. With all this hacking going on and the privacy of medical records, have you had a conversation with them about, how well they are prepared to prevent hacking, given that these are going to be records of our folks now?
Perry, the CIO of the Department of Information Services, and John Wemple, the implementation specialist, they had an in-depth conversation with Ocean, and they feel that their security will be fine.
We were lucky to be able to utilize county resources to be able to really ensure that those preventions are taken.
obviously, because especially with medical records, privacy is so critical, and there's so many threats out there. Yeah.
Yep,
Okay.
agreed.
Thank you.
Any other questions from the committee? Can we get a motion to approve by Brian, second by Wanda? All in favor?
Aye.
Any opposed? Unanimous.
Thank you.
That's it. Move to adjourn.